good evening. My name's Michelle. I'm one of the members of the AQ team here in the UK. I am waiting for Dr Nina Bal to join us, so it's really exciting this evening. So hi AMP Clinic, hi Adam. I'm just going to wait until Dr Nina joins us. Hi Nina. So I will just add Nina. So excited about this. So we're just waiting for her to join us now.
Hi.
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 Oh, let me just move that so you can see more than just the top of my head.
Okay. You look lovely.
So do you. Lovely. So thank you so much for joining us this evening, Nina. So
Pleasure.
what I'm going to do firstly is, for those of you that are AQ followers and may not necessarily follow Nina already, I'll give her a brief introduction. So Nina is actually a cosmetic dentist and a facial aesthetic doctor. She has been on TV programs like The Body Fixers on E4, and you were the main cosmetic dentist in that, weren't you, Nina?
Yes.
And she has been on the Good Morning Show with Holly and Phil, in numerous publications. I won't go on and on and on, but things like The Telegraph, Tatler, very highly rated celebrity doctor. And she is an AQ Skin Solutions user and ambassador as such.
I love her.
So that is Nina. As I said just before you joined us, Nina, my name's Michelle and I'm from obviously AQ Skin Solutions. For any of your followers that don't actually are wondering what this is all about, AQ Skin Solutions is a growth factor product line. Basically, we have 6 products and they are all growth factor based. They are all for skincare or hair and scalp care, and they contain specific human growth factors or derived growth factors that are cytokines and skin specific for us. It basically reignites cellular regeneration in different formats for the areas of the body, and we use different ways of applying it to the face, scalp and body. So that's a little overview. If you want more information after this, you can DM either Nina or myself. So let's get to it. I know recently, Nina, you actually had our masks in your gifted box. How well did that go down? Really well, your gifted box? It seemed to. It sold out immediately.
I did, yes. So as you know, I've been an AQ lover for many years, and so when I was creating my the content of my gift box, I was really choosing and then thinking what could I put that really could give my clients the very best results. So I just put the intensive moisturizer repair mask from AQ, which I personally love, and they have actually been a godsend to me during lockdown, and
Absolutely.
as I know for many other people. So has been so helpful just to do something a bit more intense to our skin when obviously we're not able to go to the clinic. So they have been amazing for myself and for everyone that has been purchasing the gift box. I absolutely loved it, and yeah, so I had amazing feedback.
Fantastic. And I must admit, I have been using them a lot myself.
Yeah.
For anyone that wants a bit more information, you do get 5 in a box, and you can purchase them either through Nina or ourselves. Or have you still got some of your gifted boxes left, Nina?
I have to double check. I think it's all sold out. I
Yeah, I
think,
think.
but I'm not too. Yeah, I'm not 100% sure. I have to double check with the team, but I'm pretty sure it's sold out. Yes.
Okay. So in your clinic, do you want to let everybody know where your clinic is based and what kind of treatments that you offer as a generalization within your clinic?
Yes, absolutely. So, as you already said, my background is in dentistry, but actually I'm now only doing non-surgical treatment. I've got 2 main clinics. One clinic is in Belgravia, and the other one is in Melbourne. So what I mainly do in my daily routine is anything from injectables, skincare, skin treatments, and what I actually love, one of my favorite treatment from AQ is actually the Derma Stamp with the recovery serum. So it's my go-to treatment whenever I want to tackle and address anything from active acne, pigmentation, scarring, actually, because what I find in my practice is that there aren't many treatments that are really effective on scarring. Scarring are really, really nasty. And what I love straight away about AQ Skin Solutions, to me, when I first found out about it, it made so much sense, because we've got so many products out there which contain plant-based growth factor, which work on plants, as Dr. Okatani explained to me. I was like, yeah, that makes so much sense. Whether there was nothing that was near AQ Skin Solution. So and the main difference that I found in my practice and on myself is in the results. So you can see the difference in the potency, in the efficacy of the treatment or the products, whether you use the active serum, which for me, I think maybe it's my number one top favorite product, which I recommend to all my clients, and I use them myself, or whether you go a bit more intense to do an in-clinic treatment, and then obviously I would use the recovery serum, which is only available to healthcare professionals, and then in that case I will also use the Dermastamp. Yeah, exactly. Which to me, that it's my magic wand. So with that, I can treat everything. I know I can heal anyone so quickly. I can treat scarring, pigmentation, acne. It's like whenever there's an issue, I've got my recovery serum next to me, and I know that honestly, there's nothing like it.
Absolutely, it is amazing. It's completely undersold. I think people really don't know about recovery as much as they should, and that's for clinics and consumers. I got a WhatsApp this afternoon from one of our other clinics who was actually letting me know that somebody's got some 3rd-degree burns and they're after recovery. So it's used for so many things, and was originally, just so that people know, it was originally created by Dr. Ahmed Al-Qahtani, who is the founder of AQ, for healing wounds, so for 3rd-degree burns and really severe scarring and actual medical grade issues that it was used in hospitals, and then obviously from that people started to realize that actually it works from an aesthetic point of view as well. If it's that great for a medical format, then how well is it going to work on just already decentish skin? And it is astounding. So obviously it can work on scarring, as you've mentioned, Nina, and it can work on acne, pigmentation, so many different kind of skincare ailments that it can work on, as well as anti-aging, which is amazing for it as well. Do you use it in clinic for anti-aging as well as for scarring and things, Nina?
Yes, I do. And actually, it's one of my favorite quick pre-carpet facials with very little downtime, obviously when we could go out. But it's amazing because it's so versatile. It's so quickly done, obviously in expert hands, and it's got so many benefits. So honestly, it's great. It's great for active acne. It's great for pigmentation. It's great for if someone wants a bit of a glow, a bit of like a skin rejuvenation, a bit of like bit healthier skin. So it's amazing, fantastic treatment pre-event, pre-photo shoot, pre-wedding. I'm sure I'm going to have a lot of treatments after the 21st of June when we are allowed to go out and have dinners again. It's so versatile. And as I said, to me, what convinced me so much, it's the science behind it, that it's incredible. So when I understood, Dr. Hamid Al-Khatani explained that the fact that obviously was originally found and used to treat wound, and actually the principle behind wound healing and skin rejuvenation is actually the same. I was fascinated because no one, I think, approached anti-aging and aesthetics with that angle, which makes so much sense. So I think in that sense, it's just different to any other product that I found. And as I said, it's all about results, because of my clients, they want results, and I want to deliver results. And I know that whenever I use those products, whether it's prescribed for them to use at home, like the active serum or the eye serum, or in the clinic, I know that I get results, they get results, and they're really happy.
Yeah. What are your favourite products to recommend that people use for home care and things like that? Do you recommend any of our products for that as well?
Yes, I do. So normally the two main home care products I recommend to lots of my clients are the active serum, AM and PM. I would say just go for it. You can absolutely use it twice a day, and the eye serum. And these two are a must. Then I obviously during lockdown, I've been recommending a lot of the repair mask as well. Um, the lash lift as well. I think now, again, because we've all been in lockdown, we're all very looking
Yeah.
ourselves at our eyelashes. We have not been able to have whatever treatment we used to have before, whether it's just even like a shape and tint for the brows, or whether it's like LVL lashes or lash extension. I think we all been focusing actually on perhaps doing something for the health of our hair, of which either hair or actually eyelashes. So I think, you guys have a range that covers that as well. And I think people actually, I think after lockdown, they're even more aware of doing something for, perhaps before they had no time to think, oh my God, I need to do something for my lashes, or but now they had time and really want to invest in getting the skin, eyelashes, and hair in the best condition.
Yeah, absolutely. It's that whole self-care, isn't it? More than ever, that is the real go-to word. And it has been all the way through all of the lockdowns, really, the whole
Yeah.
self-care motivation, which we do still need to carry on once everything goes back to normal, I think, because I think that's one of the things I've noticed the most, that we didn't really give ourselves as much self-care as we should have done.
Yeah.
And now we've actually had maybe a little bit more time, and people have really pushed self-care and taking care of ourselves physically and mentally, that actually maybe we've all given ourselves a little bit of something that we weren't having before. And I know myself, because of not being able to get out to salons and things like that, eyelashes was one of them. I
Yes.
mean, I've you just get into the routine of having your eyelashes done,
Yeah.
not thinking about it, and then the first lockdown hit, and I straight out with our AQ stuff, lapping it
Yeah.
on my eyebrows and lashes. I was like, oh dear. And then when we had the end of the first
So true.
lockdown, I was so stupid to just rush back and get them done again. And then I'm now in the same boat again, except this time I've decided, you know what, the AQ works that well that I'm just going to leave it. I
Yeah.
don't even need them.
It's so true.
So,
It's so, so true. I think all this time I've really made us think about which priorities are actually our real priorities and what is
yeah,
important and not. And I think so true. Whether obviously we were forced not to have the nails done then. And for me, my main thing is my hair, having my blow dries. But actually then I've been focusing on restoring the health of my hair and having less heat on. So as you said as well, same for the eyelashes. So I agree. I think it has. I think we all experience the same thing, which I think it is a good thing.
yeah. Absolutely. So if anybody is obviously listening to myself and Nina and wondering what you can actually purchase, and Nina's recommendations of the active serum and the eye serum and the masks, you can obviously purchase that through Nina, or you can obviously contact AQ directly. And are you doing online skin consultations and things like that, Nina, at this moment in time?
Yeah, so I've been doing a lot of consultations in January and February. Now I'm still doing. I am,
Okay.
yeah, not as much as I was doing the last few months because we slightly are opening more for medical treatments at the clinic, but I'm still, so I'm more than happy, obviously, to, if anyone has any questions or wants to know more, I'm more than happy to schedule a
Yeah.
consultation and
The good
help.
thing with AQ is it's suitable for anybody of any
Exactly.
age, which is one of the really, really key things about it. So whatever your concerns are, AQ can pretty much fit into any of them. And also it fits into lots of treatment plans. So people might also be having things like laser treatments, or they may be having,
Yeah.
anti-wrinkle injections or fillers. And it also fits into those kind of things. Because I always say your skin, and you're probably always telling people this more than I even do, but I'm always saying to people, it's like you're painting canvas your face. If you don't take
Yeah.
care of that, all the other things that you do won't, you'll notice, but they won't be as impactful as if you took care of your actual overall skin health. It's so important to make sure that your skin health is in top form. And I think we've gone into that much more over this last year. I think because of the lockdown, I think there was a few years ago this kind of trend to just have anti-wrinkle and fillers. And I think people are
Yes.
realizing now that they can get so much more out of those kind of treatments if they keep their skin really healthy as well.
100%. I could not agree more. And what I normally say during my consultations to my patient is, this is your insurance policy for any treatments that you do out at the clinic. So because if you don't, then you really lose so much of the potential result that you can do with an in-clinic treatments. And if you don't want to have an in-clinic treatments, absolutely fine. You can get so much with the correct skincare. And I think because there's so much information out there, people actually are getting confused. They're thirsty to know the truth. People want to know the science now. They are not, they don't want to get trapped, and they don't get trapped anymore into all the marketing, sales, and they know what works. They want to know the science behind what actually works. And every time I explain, even just a little bit of the science behind those products, it just made so much sense. Like, it made so much sense to me when I first heard about those products. And again, for me, what it's my top products that I always want to have at home are my active serum, and actually I want to share a personal story about the recovery serum. Two stories, which are obviously very close to me. So one is my dad, who had a very he had 3 surgery about hip replacement in Italy, and he had 3 surgery. They all went really wrong, unfortunately, so he had to have them quite close to each other. So he was left with a huge blister, but it was like this big in his
Oh,
leg.
wow.
And because during the leg surgery, I learned they hang the leg, so
Really?
the traction, yeah, that's what I learned. I don't know if that's the right
Wow.
way to do it. So the traction opened the skin, so he had a huge wound, and he was struggling for weeks and weeks and weeks. And the only thing that cured him was the recovery serum. I was lucky enough, obviously, to have it as a medical professional, and I shipped that. And my mom's like, make sure you send me also my active serum, my eye serum. I'm like, yes, I will. So I shipped that as well. But that treats completely. And that really made me realize how potent those growth factors are. There's nothing like it.
Yeah.
And they really treat. There's so many before and after also you can find online about acne, about anything. And the other story was my my second son had a huge nappy rash, and for weeks, and he wasn't healing, and he was on antibiotics. And again, I know it's slightly off, the way we use it, but I was so desperate. I was literally, he was crying every night. I was crying. The pediatrician didn't know what to do anymore. The only thing they treated was a couple of drops of recovery serum. So this stuff works.
Wow.
It's
Yeah.
super potent, and it works. And in terms of, so yeah, that's been
Yeah.
incredible for me.
It is astounding that it does work on anything that is a skin kind of ailment, wound, anything it works on. And just like yourself, you try and get across to people exactly how powerful it is.
Yeah.
Luckily, we do have a lot of peer-reviewed research and white papers and things to back everything up with AQ. And I think that's one of the things that puts AQ quite far in front of other brands that are out there that might have growth factors within their product ranges. AQ is completely focused on growth factors, and wound healing and skin anti-aging. So all of our research is based on that. And actually all of our, just in case people don't know, the formulations we use cannot be copied. They're all patented formulations, which is absolutely amazing. And it is a global product as well. It's not just available here. It comes from the States. So Irvine, California is where it's actually made and manufactured. And then obviously 52 countries globally and counting, onwards is where we're now available. So yeah, it is a phenomenal brand. It is mostly an in-clinic professional brand, because we entrust obviously people like yourself, Nina, who know exactly what to look for in the skin and how to treat things. And you're the people we trust with the brand. There are some, as you've mentioned, the active serum, the lash and the eye serum that are home care products. But the real kind of amazing things that you see comes from the microneedling and the recovery serum and our hair complex, which you get from in-clinic treatments. So yeah, absolutely amazing. It's great to hear stories like that though as well, Nina, about your dad and your baby, because it just
Honestly,
shows how versatile it is.
yeah, exactly. And that's the only, and literally the only thing that has worked. And I think when, and I always talk about it with so much passion, because obviously it was tragic in both situations.
Yeah.
And we really tried everything first. And then I was like, let me try the recovery. And that has been absolutely incredible. So my trust in the product increased even more. And it's, yeah, so I always have it in my house, and I could not recommend it more.
Yeah. What would you say with regards to, because there's a lot of companies out there, and also different types of microneedling that people can use at home. And one of the things that I get asked a lot, and I don't know if you also get asked in clinic or you've been asked while people are doing treatments for themselves at home, is kind of like your dermastamps versus the rollers and things like that. And what advice would you give to people for things like that at home?
Yeah, this is such a great question, because it's true. People asking me all the time, especially now, I think, when they are home and they want to do something,
Yeah.
and they try to do like DIY skincare treatments. So bottom line is, and I know that we agree on this, what I recommend to my clients is, first of all, to don't really do anything at home, but to come in the clinic. And at the clinic, what I personally do is I use the derma stamp compared to the derma roller. So if whoever's watching is not sure about the difference, I'll try to actually show you and explain. So the derma roller, so the both are microneedling device. The derma roller, it's a roller. So you can see the needles are all around the device. So you literally roll it on the skin. Whether the derma stamp is got the needles only on one surface, so you literally stamp it on the skin. The difference is that, and I was actually meant to do, I'm going to be doing a video on it. I showed this on a banana, on the banana skin. So if you get a banana and you, half of the banana skin, you roll it over with the derma roller, and the other half you stamp with the derma stamp. You can see the difference after a few minutes. So in the areas where the derma roller has been used, everything is scratched and black and oxidized, and it looks all messy. Whether in the derma stamp area of the banana, everything is neat, and you can see the needles, they've not been dragged. So the
Yeah.
problem of using the roller is that very easily can get drags on the skin. So you can create some tears into the skin. You can damage the skin. So actually, instead of professionally and intentionally activate the cascade of chemical reaction of collagen production, you just damaging the skin and creating tears. So it can potentially be not good for the skin at all. Whether by
Yeah.
using this, so the growth factor induced treatment therapy, what the way it works is that I apply first of all on the skin the recovery serum, which is the most active form only available to Africa professional of the growth factor. And then on top, I use a derma stamp in a very specific way. So the technique has to be a very specific technique, and in a way also we change the direction of the needles so we can activate the collagen fibers, which have a specific orientation, without dragging it, without tearing the skin. Do you agree?
Yeah, absolutely. I couldn't agree more. I even did a post on my own page a couple of weeks ago about it, because I was getting asked so many questions about differentiating the fors and against, and realistically, as you've mentioned, it's those micro tears that you get, because when it goes round, it's so uneven, of how it's penetrating and then coming out of the actual top layers of the skin. So yeah, you couldn't have put it better than that,
Yeah.
Nina, to be honest. So thank you for that. It is something that is probably going to be quite concerning when clinics fully reopen and people come in saying, well, I've been rollering, because I've
Yes.
also heard of people rollering every day, And
Yeah.
they're going to obviously be overusing it, because you see great with whatever microneedling you do, you generally see fantastic results, because microneedling
Yeah.
stimulates that collagen and elasticity response that you've just mentioned. So obviously it can be quite an addictive thing to have at your disposal at home,
Yeah.
roller in the face or stamp in the face every day, because you see such great glow and tightness on the skin. But if anybody is doing this at home and you're listening to us now, please don't do it every day. Please minimize what you're using. If you're not sure, contact a professional, or whoever you bought the device off is a good recommendation as well. So yeah, are there any other
Absolutely.
tips that you would advise for people to do whilst they're at home at the moment? Because luckily, fingers crossed,
Yeah.
we don't have that much longer.
Yeah, exactly. Exactly. I'm just, yeah, my next goal is for school to reopen next week and the hairdresser. And then I'm absolutely super happy. No, absolutely. So just touching quickly on what you said about microneedling, which I think it was absolutely spot on. Also, if people, because I call them the Amazonian derma roller, because you can buy them on Amazon
Oh,
yourself.
yeah.
So called the Amazonian derma roller. If you have skin conditions, so if you buy yourself without having your skin concern diagnosed, let's say for example you've got rosacea, inflammation, psoriasis, dermatitis, it can actually do so many damages to your skin. Whether if you have the treatments done in a clinic, let's say, even if you have rosacea, but just by using the correct serums, the recovery serum, let's say, for example, actually we can calm down the inflammation. So it's all about having a professional diagnosis first and do it properly. I just had to add that. And then in
Yeah.
terms of, yeah, what people can do now, I think they can just use the active serum, I think absolutely every single day. Great because you're waiting to have in-clinic treatments. It's a great way to work on your skin. So then when we're allowed to do any aesthetic treatments, hopefully from April onwards, your skin will be in the best condition so you can get the best results out of everything we're doing. And absolutely go with the repair masks. Brilliant. So whenever you're at home, well, you're always at home, just use them. And I think, again, it will just help us in the clinic once we reopen, just to give you the best results.
Yeah, absolutely. Even when we were able to go into the clinics, and I mean, I do treatments on myself, and I am, just to state this, I'm saying that because I am a professional skin therapist as well. But obviously, even before the lockdowns, I used the masks in between treatments. They're great in between in-clinic treatments. So obviously, people that come to yourself for their treatments, that it's a great add-on for them, isn't it? With the active serum, and then using that maybe once a week is perfect for keeping
Agree.
your skin at that optimal kind of glow and tightness, is what I say, because the masks themselves actually contain quite a lot of moisture boosting ingredients as well as the growth factors, so that's great. I don't know if anybody's got any questions for Nina, or even myself, or for both of us. If you have, then pop them. I've not noticed any that have popped up that I've seen that are specific to anything. I've seen a lot of love for you, Nina.
Oh, thank you. But I'm sure it was for you as well. It was equally shared, I'm sure. Um,
But I'm just waiting to see if we've got any questions that pop up. I don't know if you've seen any questions from anybody.
I haven't, but yeah, if anyone has any question, perhaps come later on. Feel free to DM me. I'll be more than happy to help and answer anything. And I agree actually about those masks. I think actually what they actually do, they minimize and reduce the downtime after clinic treatments. And I think once we reopen, everyone wants to make sure they can just heal quickly. And I think that's a great way to just help the skin to repair really
Yeah,
quickly. So
yeah.
so yeah, absolutely.
Yeah, that's a really good point, Nina, about it bringing down the recovery time. And the good thing about recovery, as you've mentioned, because of how well it actually works to heal the skin, it means that our actual G-Fit treatment, the microneedling treatment, your downtime is very minimal. So
Yeah,
when clinics reopen, it is the perfect treatment to have if you're wanting your skin to look really great quite quickly, but with pretty much zero downtime. You get a couple of hours of reddening and erythema on the skin, but after that, it's just results all the way. So
agree.
yeah, it's it's a really good point that you made. I can see, how often should you have a dermastamp treatment? I will let you answer that, Nina.
Yeah, so obviously it depends on which skin concern we are treating. So that all depends on the diagnosis that can be done professionally. But I would say if we're treating, and it can be just one off if you want to have a nice glow before whatever reason you want to, an event, a photo shoot, or whatever you want. Or if you were treating, let's say, pigmentation or acne or scarring, then it has to be a course. So every skin treatment, I like to say, it's like a bit like going to the gym. If you go once, great,
Yeah.
better than nothing. But the results are achieved once you go consistently. Same thing for the skin treatments. It's not like injectables. It works in a different way. So I would say one session every 2-3 weeks, and anything
Yeah.
between 2 to 5, 6 sessions.
Yeah, absolutely. So hopefully that's answered that for you. That's the only question that I can see. I'll have a quick flick to see if there's any others. Oh. Just a lot of people saying thank you for sharing.
Oh, good.
So
Just
yeah,
a
at the
question
moment I
about the
can't see.
pores. There's a new question that came up about enlarged pores. So to treat the enlarged pores, again, in terms of active acid in skincare, you can use anything from alpha hydroxy acid and retinol work really well. In terms of the active serum at home, absolutely go with this. And then the included treatments as well. The dermastamp with the recovery serum would just help as well. So combination of everything, I think works really well.
Yeah, absolutely. So I mean, open pores with regards to the GFIT, it's not contraindicated or anything. It will work really well with it. So yeah. So it's always quite funny when you're trying to wait to see if there's any more questions so that you don't. But obviously, yeah, please do contact either myself, not myself, but AQ, or Nina herself, if you've got any questions about anything. It's been such a pleasure to speak to you, Nina. Is there anything else that you would like to say about AQ or anything?
Just
I think
first
you've
of all,
covered
thank you for
everything.
having me. No, thank you so much for having me. It's been such a nice treat to spend half an hour here. And then thanks to Dr. Hakatani for creating those amazing products. As I said, I'm really grateful for my own family, as I shared, and myself and my clients. So thanks for you guys.
Oh, thank you. And I'm sure he will be watching this video. If he isn't watching now, he'll be watching it shortly. And I think we all thank Dr. Ahmed Al-Khatani.
Yes.
The AQ products are amazing.
Amazing.
So yeah, and I cannot thank you enough, Nina. It's been an absolute pleasure to speak to you, and hopefully we will be able to do this again at some time soon. I'm sure everything in about 6 weeks is going to go crazy for everybody anyway. So
yeah,
fingers crossed that's what's going to happen still.
yes,
but thank you very much.
So.
Have a wonderful evening, Nina.
My pleasure. Same to you, and thank you to everyone that's been watching, and we really appreciate it.
Yeah, thank you very much. It's been great to have you all here, and I will turn it all off now.
Okay, see you soon. Have a nice evening. Thank you so much again. Bye.